Never before have doctors been able to observe it with such clarity and detail. It's leading-edge technology available in our area only from Dr. Pierre Atala at the Rochester Diagnostic Center.
3D CT imaging is the new technology. It utilizes fast scanners that produce very thin slices down to 0.5 millimeter, and that allow us to obtain high-quality images that are truly exceptional, very accurate, and very precise.
This life-saving technology gives doctors a superior way to diagnose a number of medical conditions in just minutes without invasive heart catheterization. One of the most important uses is to check previous heart bypass grafts. Here, a quick scan shows the patient's graft is normal. But in this case, the grafts have disappeared. By spotting the problem, doctors could insert a stent and save the patient's life before further trouble developed.
It's miraculous, this procedure that he discovered, to be able to see inside your heart. I mean, I could hardly believe it, but I saw it, so I knew it had to be, you know. And it's really helped Dr. Atala with these patients, I'm sure. I know he certainly helped me.
60 to 75% of people who have heart attacks have no symptoms beforehand. Dr. Atala says a 3D heart scan can spot problems early in people with risk factors. Now here's a heart scan from a patient who had no symptoms, but because of his family history and other conditions was at a higher risk for heart problems.
And look at what we see here. In his left anterior descending artery, this is the main artery to the left ventricle, there is an 80% soft plaque. We call that one the widowmaker in cardiology.
There is no comparison as far as I'm concerned. The CAT scan, you just lay there and relax. There is no cutting or anything else. It's a non-invasive test, and it shows everything that the catheterization showed at a later date.
The 3D CT scanner can study all parts of the body. Here's some amazing pictures from the brain of a 22-year-old.
This patient has no symptoms, but a strong family history of aneurysms. So we did a CT angiogram of her brain, and within seconds, we were able to demonstrate that she does have the same problem as others in her family. We can see here a 4-millimeter aneurysm of the basilar trunk. And she's lucky because we can close those non-invasively.
And while doing a chest scan, Dr. Atala spotted a kidney tumor. It was removed, and the patient's life was saved. Early detection is key, and prevention starts with you.
We have to change lifestyles, and we have to make early diagnosis. That's the only way to prevent, the only way to cure.
Decide if a 3D scan may help you. For more information, call Dr. Atala at 248-656-3105 or visit their website at rochestermedicalcenter.com.